Hello, Silver Queens viewers. Today, we're going to delve into heavy ion therapy, which is being called a revolution in cancer treatment. Heavy ion therapy is an advanced cancer treatment method that differs from traditional radiation therapy or surgery. It's an innovative technology that precisely targets and destroys cancer cells. This treatment is also known as the dream cancer treatment because it minimizes side effects while maximizing treatment effectiveness. Heavy ion therapy offers new hope, especially for patients with refractory or recurrent cancers. The core of heavy ion therapy is the use of carbon ions. This treatment involves accelerating carbon atoms to 70% of the speed of light and irradiating cancer cells. Compared to conventional radiation therapy, heavy ion therapy effectively destroys only cancer cells while having minimal impact on normal tissues. This is due to a physical property called the Bragg peak, where the energy is explosively released when heavy ions travel through the body and reach cancer cells. Heavy ion therapy has several advantages. First, the treatment effect is very high. It shows 2 to 3 times higher treatment efficiency compared to conventional X-ray or gamma-ray therapies. Also, the treatment period is short. While typical radiation therapy requires more than 30 sessions, heavy ion therapy is usually sufficient with an average of about 12 sessions. This greatly reduces the burden on patients. Furthermore, there are fewer side effects because it hardly affects normal tissues. Recovery to daily life after treatment is faster. Heavy ion therapy can be applied to various types of cancer. It is particularly effective in cancers known to be refractory, such as pancreatic cancer, liver cancer, and lung cancer. According to research results published in Japan, the 5-year survival rate improved from less than 20% to 53%. When heavy ion therapy was performed before surgery on patients with operable pancreatic cancer. In the case of patients with inoperable pancreatic cancer, the 2-year survival rate also improved from less than 10% to 66%. When chemotherapy and heavy ion therapy were combined. Now, let's take a closer look at an actual case of heavy ion therapy. A stage 3 pancreatic cancer patient was treated with a rotating heavy ion therapy machine. Pancreatic cancer is known as a refractory cancer, with a 5-year survival rate of less than 10%. But the patient's condition improved significantly after receiving heavy ion therapy. According to research results in Japan, the 5-year survival rate of pancreatic cancer patients who received heavy ion therapy increased to 56%. In particular, heavy ion therapy is becoming a new hope for liver cancer patients. The 2-year local control rate for liver cancer patients treated with heavy ion therapy at Gunma University Hospital in Japan reached 92.3%. The local control rate means the probability that cancer will not recur in the treated area. In particular, even when the tumor size was large, over 4 centimeters. The 2-year local control rate was 86.7%, and the 2-year survival rate was high at 68.3%. Another advantage of heavy ion therapy is that it greatly improves the patient's quality of life. A 70-year-old female liver cancer patient said, "There was no discomfort during the treatment, and it was even more comfortable than taking a CT scan." In addition, the short treatment period and the minimal impact on daily life are also significant advantages. In the case of prostate cancer, treatment can be completed in 3 weeks, lung cancer in 1 to 3 weeks, and liver cancer in about 3 weeks. The effect of heavy ion therapy has also been proven in head and neck cancers. A stage 4 nasal cavity cancer patient was cured after receiving heavy ion therapy at Heidelberg Hospital in Germany. This patient had cancer cells infiltrated into the right brain and optic nerve. But after 33 sessions of heavy ion therapy, an MRI scan showed a complete cure, and he is currently living a normal life without any problems. However, there are also some precautions to take with heavy ion therapy. It cannot be applied to all cancers, and it is particularly difficult to apply in the case of blood cancers or widely metastasized cancers. In addition, long-term research is needed to more accurately evaluate the effects of heavy ion therapy. In the United States, heavy ion therapy was discontinued in 1993. but is now being promoted again. This is because there were insufficient clinical trial results to prove the effectiveness of heavy ion therapy. Although not yet generalized, it is expected that the survival rate and quality of life of cancer patients will greatly improve as heavy ion therapy continues to develop and become more widespread. However, there are still problems such as high treatment costs and limited facilities. And solutions to these problems are needed. If these challenges are solved one by one, heavy ion therapy will become a greater hope for cancer patients. The future of heavy ion therapy looks very bright. Currently, research and investment in heavy ion therapy are actively being conducted worldwide. In Japan, 6 heavy ion therapy centers are already in operation, and new facilities are being built in Europe and the United States. In addition, research is underway on establishing heavy ion therapy plans using artificial intelligence AI technology. It is expected that AI can be used to establish optimal treatment plans that consider the characteristics of individual patients more quickly and accurately. The National Institute of Radiological Sciences in Japan has already developed and is using a treatment planning system using AI, which has reduced the treatment planning time from 30 minutes to 5 minutes. Another advantage of heavy ion therapy is that retreatment is possible, while it was difficult to retreat areas that had already been treated with conventional radiation therapy. Heavy ion therapy has little impact on normal tissues, making retreatment possible if necessary. This can be a great hope for patients with recurrent cancer. Along with the development of heavy ion therapy, the importance of cancer prevention and early detection should continue to be emphasized. According to the National Cancer Center in Korea, 30 to 50% of cancers are preventable, and more than 90% can be cured if detected early. Therefore, it is very important to maintain healthy lifestyle habits, such as regular checkups, non-smoking, moderate drinking, a balanced diet, and regular exercise. Cancer is still a major burden on our society, but the development of innovative treatments such as heavy ion therapy gives us hope. Together with continuously developing medical technology, we can create a society that is more free from cancer, if we all strive for a healthy life. Until now, this has been Silver Queens.